Welcome to a Dan Good podcast, another episode. My name is Dr. Daniel Martinez. I've been a psychiatrist for many years, and in this platform, I'm here to share some of the experiences that I've learned and how I can go to you, my audience, on a number of different topics. For today, we're going to focus on anxiety, which is probably the most common topic that comes into our office. So many people living with anxiety these days. What do I mean by anxiety? Tension, worry, but anxiety can manifest itself in many other forms. And we're going to talk about this today as we move along. But probably the saddest thing that I hear is people coming in feeling like they're broken, feeling like their life is not worthwhile, and feeling like there's something wrong with them. I want you to know, my listener, that you are not broken. An individual who has anxiety is just going through some issues, but they're not broken. Their body's just informing them that there is something. What's going on? There's something going wrong, and that's it. That's all you need to know for right now. Your body is trying to protect you, and that is why individuals feel the way they do. We can talk about the limbic system, the amygdala, basal ganglia, but these are centers that are just informing us that there are significant problems, but our body responds as if there is serious danger. So that's all that is. And so we need to focus on the idea that we live in a world where our body lives in the present, but our minds either live in the future or they live in the past. And so when we live in the past, we can oftentimes become depressed. We talk about depression is the main focus of individuals living with regrets and living with guilt, living with a sense of hopelessness, worthlessness. People with anxiety live too much in the future, always fearing of what's to come. And so when individuals have a clinical issue with anxiety, it's because they're fearing the unknown. And so that's the focus. The idea is that anxiety is not a weakness, but people believe it is. Anxiety is simply an hyperactivated alarm system telling us that there is danger. It's not a lack of discipline. It's not even a lack of faith. All these myths are absolutely and categorically not true. It's not a moral failure. Imagine a fire alarm that every time you put your toaster on, the fire alarm goes off. And that's simply it. The body telling us that there's something going wrong. One of the most common ways in which I hear people tell me is that when they feel anxious, they're feeling like a dog is chasing them or a dog is barking at them. Our hair stands, our heart starts palpitating faster, we start trembling, we might even start precipitating and sweating. And so we feel like there's a dog, like there's danger because a dog is behind us. But there is no dog, there is no imminent danger. That's anxiety. And so what we need to do is figure out ways how we can manage all that without allowing those fears to cascade into a full-blown panic attack. And panic attack is when everything falls apart. I don't want to talk about panic today because I want to keep it short, but in the next episodes, perhaps we can talk about panic. So anxiety is not healed by fighting it. It's like trying to swim against the current. You're not going to get very far. The important thing is that we start understanding where our anxiety comes from. So anxiety, keep in mind, is something that our body senses or responds in a way that it's trying to protect us. Our bodies and our mind is trying to look for safety. It's trying to look for control. It's trying to look for certainty. And so when we don't feel safety, control, or certainty, we start feeling a sense of dread and what may be going wrong. We do not want our feelings to cascade forward and get worse. We want to take control. It's almost like the volume needs to be toned down. And there are many ways in which we can lower the volume to reassure ourselves that things are not out of control. We haven't gotten into an unsafe situation, or we haven't gotten into circumstances what we can't control. Of course, it's important to reflect when we do feel uncomfortable, because Perhaps we are in an unsafe situation. Well, it's time to take action. We might be feeling like we're out of control or be in a precarious circumstance. It's time to take control. The important thing is that we keep thinking clearly about what's going on and take action to reassure ourselves or to get the support when we feel like we're losing it. When people feel like they're losing their mind, that might be going into a certain area where people feel like there's panic. Panic is, like I had said in the past, I don't want to get too deep into it, but panic is a person is really losing control. It's almost like they're feeling like they need to end up in the hospital. But that's not anxiety. Anxiety is just understanding that we need to step towards it so that we can understand it and not be afraid of it. I love the word desensitization. Rather than running away from a problem, oftentimes what helps us is to run towards the problem and face it, resolve it, and then the next time that we face the same circumstance, it'll be easier. For anxiety, let me give you a number of the characteristics of anxiety. A person that feels worry, a person that feels tension, a person that feels irritability, a person that feels like they can't concentrate, a person that feels problems with sleep or issues with restlessness. These are the signs and symptoms that constitute anxiety. Suffice it to say that if you're feeling some of these issues that are not allowing you to live the way in which you believe you should be living, that could be a problem. And so the question is, so what do I do? Well, let me tell you, my friend, there is no magic in this world. There is no one pill or one technique that's going to help you. Different individuals may need different approaches. There are three main focuses that we do always need to talk. The first one is psychoeducation. There's a lot of self-help out there. There is the issue of an overactive nervous system that may need some support. And then there is the human element to all this, where we need to reach out to other individuals in our lives that can be of support. So first, psychoeducation, understanding that in many ways, anxiety is an attitudinal problem where we talk ourselves into scaring ourselves. And so we need to take stock and understand that the problem may not really exist as it is. In fact, probably most of the things that we fear never come to fruition. So it's really important that we understand that. The next thing is the idea of the nervous system. Oftentimes, when we get scared, we start hyperventilating. And so the most important thing that we can do in that circumstance is lower our breath. I like to talk about the 4, 5, 6 step. You inhale for 4 seconds, you hold it for 5 seconds, and then you release for 6 seconds. And you do that 5 or 10 times, and you'll notice an immediate change in your body. Going for a walk, dissipating some of that excess energy that we might have is important. That's why exercising is so profoundly important. Body awareness is elemental to having good mental health. Eating correctly, sleeping sufficiently, and exercise could be very important to feeling well. And then the other thought is support. It is a real epidemic in this country right now that too many individuals are suffering from isolation. So finding healthy, credible, caring people that could walk with us along our daily lives is very important. We know for a fact that we keep talking over and over on social media that isolation is a huge problem in this country right now. So finding good friends, relatives, good partners is very important for our mental health. Anxiety grows with isolation. So really important that we clear that up and that we improve on that. Let's review. When we talk about anxiety, it's not that we're failing. Anxiety is simply telling us that we're surviving and we need to do something because there might be something fearful. The next step is recognizing that anxiety does not define us. Anxiety is just an alarm system that tells us that there might be danger, and then it's up to us to figure out if there truly is a problem that we need to do something about, or if we should just continue, or what is the change that is appropriate for our circumstance. Anxiety can oftentimes be a sign that we are carrying too much, we're doing too much, and that we need to slow down. It's important because in this country we will talk about, when is it enough? When have I worked enough? When have I contributed enough? When have I exercised enough? We go overboard on everything. And so anxiety may be asking us to reflect on what we're allocating our time to. You're not broken. If you're anxious, you're not broken. You're just on high alert. Really important to keep in mind, because sometimes focusing on that could be important. Sometimes receiving a word of trust and confidence could be the best thing that we could do. If you find that this has been helpful, you might know somebody in your family or your friend group that might be able to do something with this word. So reach out to them, share this with them if this is important. So thank you for listening. This has been another episode of a Dan Good podcast. I'll see you in the next episode. If you have found this episode to be helpful, I encourage you to continue working on focusing on these issues of anxiety. You can share this episode with a friend, and there are many things that you can do for yourself. Among the issues with psychoeducation, one of the things that we can do in terms of self-help is reach out to a workbook that I recommend to a lot of individuals. One of my favorites is Dr. Edmund Bourne, The Anxiety and Phobia Workbook. I use this book very frequently with my patients, and I ask them to go through the pages, tasks, and the techniques that they're teaching you, because it could be quite helpful. You can also find lots of support. You can go to mental health providers in your area. If there are any concerns that you might have, you can reach out to us. You can reach me at discoverccs.org for more support and guidance into obtaining professional help. Thank you very much. If you found this episode important and helpful, there might be somebody in your life that might also benefit from this. Share it. Give us a like. Help our algorithm so that we can continue to improve and continue to bring content that is important and helpful for everyday living. My name is Dr. Daniel Martinez. Until next time.